when that check they said me too then, and I'm like, that doesn't, no. It's weird.
You guys ready? Some of this we just talked about, so we'll just test your
Oh, you already started, Asha?
No.
knowledge.
It's going.
Can we talk about the other stuff first?
What stuff?
The stuff we didn't just talk about?
Yeah, we will talk about stuff we did. Okay, everybody good with height of contour?
Yes.
If you took a vertical line and came up and marched up this tooth, molars particularly, the lingual height of contour on molars is going to be up between the occlusal third and the middle third. And the buccal height of contour is always going to be down towards the gum line, cervical third. Which one sticks out more if the tooth is vertical? Buccal or lingual height of contour? Buccal. And it's because these have a buccal ridge on them. And what does the proximal height of contour, what does that coincide with? What else can we call that?
The contact.
The contact point. Proximal height of contour is always where the tooth touches the next tooth, right? Does that make logical sense to Kayla? Does that make logical sense to you? No. Proximal height of contour coincides with the contact point. Okay, so if we're standing shoulder to shoulder, and my height of contour is my shoulder sticking out, and you stand next to me, we're going to touch at the shoulder, aren't we? Always at the height of contour. Huh?
She's shorter than me.
Unless I'm Tony Romo, and I've got broken collarbones on both sides. Okay, so that's the main thing on height of contour. Just understand conceptually what it is. And because these two are at separate heights on a molar, how do we have to turn that molar to protect the gum equally on both sides? Which way are you going to tip?
Lingually.
Lingually inclined, so we protect the tissue on both sides. Right, Jose?
Yeah.
We good? Where's your height of contour when you stand like this? Tricep? Or shoulder? Tricep. I figured that. I figured that. One of these days I'll arm wrestle you, but not one of them. We got a depression on a molar root.
It's mostly mesial, right?
Mostly on the mesial, yeah. And which tooth has the most significant depression, developmental depression on the root?
First molars. No?
When I say most significant, like, well, deepest, but also most important to you guys. Which tooth is that key tooth I said that's got the most? I'm going to talk to you about that in the clinic. Remember which one it was?
Can't remember.
Yeah, first premolar, maxillary. This most significant root depression, maxillary, first premolar, mesial, almost always mesial on these guys.
First
It's, yeah, maxillary first. And because, why is it significant to you guys?
Because the calculus gets
Plaque
concentrated
forms.
in there.
Yeah, calculus forms hard to get in because a depression is a bowl, so it's hard to instrument. And it may be hard actually to probe too. So when you guys probe, you make errors in that area. No, you won't, because I talked about it, and you guys listen to everything I say, all about Mickey and everything, all the important information too. And when you go to probe, you're going to watch that area, and you're going to get very accurate. So you're going to be I'm going to be very proud of you when you're in the clinic when you do that. So let's talk about dentition periods. We already did. So when does the primary dentition period begin? About
6 months.
6
about
months.
6 months. When does it end?
3 years.
Tricky question.
Oh,
3 years.
no. 6?
12.
Primary
12.
period.
Oh, primary is 3.
3 years.
3.
Yeah. No. That's why it's tricky. Tricky me. When does the primary dentition period end?
6 years.
6 years.
6 years.
Oh, that was mixed
It
now.
only- Yeah. It only
When the first
ends.
molar, right,
It
comes
only
in?
ends. What's the next period?
Mix.
So when does the mixed period start?
6 years.
6.
6 years when the first permanent tooth arrives,
What
right?
was the question?
I know.
What was the answer? The question is, what is the answer? The answer is, what is the question?
Dentition period, what's the question?
Primary
The primary dentition period
The primary?
begins at 6 months when the child gets, which teeth come in first?
in lower incisors.
Lower incisors, central incisors.
You were like,
And when does it end? Not at 3 years when they get their last primary tooth, but it ends when the mixed dentition period begins. So that means they have to have a permanent tooth. So when does a child get all their primary teeth?
all of
All
them.
their primary?
3 years.
When does a child get all their primary teeth?
3 years.
3 years old.
3.
For some of you, when the questions are phrased, they're very specific. Read all the words in the question before you determine the answer. Don't just read the number and then pick an answer. Read all the words. And they're very specific, so not to be tricky, but to be accurate. So the child gets all the primary teeth by 3 years old, but they're still in the primary dentition period till the first permanent 6 years old arrives. You good on that?
2 to 3.
2 to 3. Let's say 3. Doesn't matter. I'm not going to ask you the difference between 2, 3, and 4. I'm going to make it easy.
So it'll be like
Got
2
it.
to 4.
3.
3. We're not bargaining yet. We'll wait till after you take exam. Then we can bargain in the garage sale. So you made me lose my train of thought.
Sorry.
Okay, primary period, 6 months to 6 years. Right?
Yes.
Yes.
Yeah.
Mixed, 6 years to,
12.
there's your 12. Okay, that's the end of the mixed dentition period. When what primary tooth is finally lost?
K9.
The primary canine coincides with the eruption of the second molar, which is about at what year does the second molar come in?
About 12.
About 12. Okay, remember you got 6-year molar, 12-year molars. 6-year molar, 12-year molars. About, okay, so that's a period of time, you got to remember those.
So the
precisely.
canine and comes out when the second primary molar comes in, kind of around the
Permanent.
same. Oh, permanent molar comes in. Yes.
I'm sorry, I didn't mean to yell at
It's okay. The finger.
I know. I can't figure what one to use. Hook 'em horns, Texas. Okay,
Yeah.
now, as far as time periods, specific years, permanent teeth, let's talk about permanent ones. When does number 8 come in?
I think.
At 8. When does the lower central come in?
7.
7. The lower's almost always before the uppers, right? So here you got, let's look at the central. 7, 8.
8.
Also, you can go 7, 8 laterals, right? 7 years, laterals next, 8. Lower central 7, upper incisors 8. Upper laterals 9. 7, 8, 9. You guys get what I'm pointing at?
Yeah.
The quiet ones in the back, in the balcony. 7 in the middle, 8 in the middle, 9 the next one's lateral. Or you can go 7 in the middle, 8 laterals. 7, yeah. It's always starts in the middle and goes back, and always starts lower and goes up. So if you just remember 7, you can figure the rest of it out. I'm not getting too much into canine eruption and premolar eruption because there's a lot of variation, and it gets very confusing when I start talking about 11, 12, is it 13, and 9, 11. You know, so I want you to remember the key teeth.
Central.
8's number 8.
Lateral.
8 at 8 years.
And 8 and 9 come in simultaneously, or about the same
Yeah,
time?
you know, unusually not very often, but they're supposed to.
Okay.
Yeah, for our purposes, they do. Okay, so everybody good with that? 7 in the middle, 8 in the middle, right here, centrals. 7 in the middle, laterals, 8. 7, 8. 7, 8, then these laterals, 9. Forget the canines for now. So if I was, say, a child was 10 years old, how many teeth should they probably have? Permanent ones, not primaries, permanent ones.
4.
No, because they're
They should
Don't
have
forget what's
8,
happening.
yeah.
9.
10?
Perfect, 8. And what are they? Okay.
Permanent?
Yeah, permanent teeth. So, not primary and permanent, but just permanent ones. So, what do they have at 10? They have, or 9 years old for that matter, They have
Oh.
lower centrals, lower laterals, upper centrals, upper laterals, first
And
molars.
Okay.
The sixes, those are the first ones. So that's the kind of time frames I'm going to make you remember. Not the big details, but the key features.
So they should have,
Does it make sense which ones I'm
Yeah.
talking about? Okay. Anyway, I think that's pretty much eruption time, permanent T eruptions, centrals 8, lower centrals 7, 8, 9, molars is 6, second molars 12. That's all pretty much as far as time frames. Don't worry about root development, roots finish developing, just many years in there to try to remember. Do you guys remember the difference between a clinical crown and an anatomic crown?
Clinical.
Yeah, what's the definition of a clinical crown?
What you can see outside.
How
The
much you
gum.
can see. If the gum line, let's say this patient has gum recession, the gum is down here. Is this the clinical crown?
That's the
No, because by definition, the root is the part covered with cementum. But this is clinical root, isn't it? Because I can see it in the clinic. Okay. The reason we say clinical crown, and the reason it may vary, if the gum line is here, because the tooth is not erupted. This is the clinical crown, because I can see this with my eye. But what's this part that's covered with enamel?
All the crown.
What is that called?
anatomical.
Anatomic crown. Remember, anatomy doesn't change. Anatomy is anatomy is anatomy. It's, by definition, the part covered by enamel, that's the anatomical crown. That's the part, when you're talking about anatomy, I make you understand it's a crown. Clinical is what you can see. Okay, so in a normal tooth that's got a healthy gum like that right at the CEJ, does it have any clinical root? No. Does it have anatomic root?
yes.
Yeah. Anatomy says this is the root, the part covered with cementum and not enamel. Okay. You guys clear on that? How many arches do we have, including McDonald's? How many quadrants?
4.
What divides the quadrants?
Midline.
How many sextants?
6.
6 sextants. What defines a line angle?
A line angle.
In plane terms, in geometric terms, what makes a line in space?
2 planes.
Two planes meet.
Mesial and labial? or-
Good. Yeah, I'm just talking in general, but you could say like occlusal and just mesial, or occlusal buccal. A line angle is defined by 2 planes. 2 flat surfaces meet, always make a line. What defines a point angle?
4. Wait. 3.
3 planes meet
3 planes.
in space. Yeah. Well, it's a square. Who's hid my booze? Oh, okay. Yeah. So a line angle, 2 planes meet. Could be buccal, mesial buccal. Can you have a mesiodistal line angle?
No.
No, because those surfaces never meet. Can you have a buccal lingual line angle? Can you have a occlusal buccal line angle?
Yeah.
Occlusal lingual, distal lingual, mesial lingual, mesial buccal. Yeah. So how many line angles do we have in a typical tooth? Molar.
8.
8. Same as a box. Okay, and so point angles defined by 3 planes come together. This plane, that makes a point, doesn't it? How many point angles on a typical molar?
4.
4. That's all you're gonna know. I'm gonna hide these tissue boxes so you can't see them. Those are the boxes. So don't look at the tissue boxes during the exam, please.
Points though would be the
On
cut.
the honor system. No, it's not a cut. It's different. Because the point, let's say a point angle on a molar might be mesial occlusal buckle. Mesial occlusal buckle.